I'm going to sum my supplies and make sure I have everything. So I have more alcohol prep pads. I have my IV needle 20 gauge. I have a saline lock, saline flush, some gauze pads, and some tape. What I'm going to do first is get some of my supplies ready. So I'm going to open up my transparent IV dressing. It's ready. I'm going to set it down. And then I will get my end mill saline flush ready. I'm going to twist off the cap. And then I'm going to push all the air out of the top. And then I'm going to open up my saline lock. And I don't want to touch the top here or this part here. I'm going to open up my saline lock, not touching anything in there either. I'm going to attach this to the end here by twisting it. Push down, and that's kind of hard. Push down and twist. And then I'm going to leave it in the plastic wrapping, not letting anything touch it. So then I'm going to wash my hands and apply my gloves. I'm going to reapply my tourniquet as demonstrated earlier. I'm going to find my vein again. I'm going to clean it with an alcohol prep pad. So I'm going to start in the center, go a circle outward, allow time for it to dry, and I'm going to repeat alcohol prep pad, start in the center, and a circle outward, allow for time to dry. So then that is clean and I'm ready. I'm going to get my IV needle out of the package. I'm going to hold it at the hub. I'm going to take the cap off by pulling it straight out. You want to bevel up and you're going to hold it like a pencil. You can slowly, just a little bit, push it forward. Push the catheter forward from the needle so it will be easier just to kind of loosen it. Okay, so you're going to hold like a pencil. You have your non-dominant hand. You're going to hold that pot. I'm going to insert this at a 10 to 30 degree angle directly over the vein or to the side of the vein. Advance until you see a flashback, and then you're going to stop there. Okay, so after you see that flashback, you're going to lower it down to skin level, and then you're going to advance the catheter and not the needle. You're going to hold that catheter in place. You're going to release the tourniquet. Press your finger down on the vein, apply some pressure, and remove the needle from the catheter. Kind of just took a little twist. And then there's this safety thing that you can do to press it up. Clicks. You don't have a needle hanging out. Okay. So now would be the time to get your saline flush. So you're going to remove the top part, the blue part there. And you're going to do this using aseptic technique. You're going to connect that together. And you're going to connect that together. And you're going to flush 5 milliliters. So while you're flushing, you want to make sure that there's no resistance, or that like the skin above it isn't filling with water or isn't filling with fluid. And then I wouldn't actually remove the catheter. I was just doing that for demonstration purposes. And then if that flush is okay, then you can remove that saline flush. You're done with that. You're going to place a chevron or like a half stitch to secure it. So you can come around here. You want to secure the saline lock, and then you can kind of twist around. And then now that is secure. There. And then you want to clean the site with your antiseptic alcohol swab. You are going to apply your transparent dressing, and you want to apply it over the catheter, or sorry, over the pink part of the IV. You don't want to completely cover your saline lock. So these are very sticky and kind of hard to do. Okay. You want to date, or you want to date it and put your initials down, and then the gauge that you used, which was the 20 gauge. And then I have a little gauze pad here we can place under the hub. This is mostly for comfort, so it's not, you know, rubbing a ton underneath. And then you can secure your saline lock with a piece of tape. And you don't want to go, you know, over the insertion part of your saline lock. You're going to want to hook them back up, or you're going to want to hook them up to your fluids here. So we have some more alcohol pads, so you can clean this here. And then going to take this off, take the blue cap off. And you can also, you know, clean this too. You're going to, without touching both middle parts, you're going to put this in and twist it. Okay, so for monitoring an infusion, you want to gather all the pertinent data. So you're going to go in, you have your patient medication administration record, you know, the 2 patient identifiers, look at the wristband, ask them their last name, date of birth, make sure you have the right patient. So in your order, you have 0.9 NS per 1,000 milliliters to infuse over 6 hours. Check your bag, make sure it's the right kind. So we did the math earlier, but the tubing set, it had a drop factor of 10 drops per milliliter. So that will give you 167 milliliters per hour. You divide that by 60, because there's 60 minutes in an hour. That equals like 2.7 something. And then you're going to multiply it by 10, your drop factor, which gives you 28 drops per minute. So you can double check, make sure that you have the right drop factor, the 20 drops per minute. You're going to want to check this every hour. You're going to want to check your tubing. You know, make sure nothing's leaking. This didn't get clamped by accident. And then you're going to check the IV site. If it's over like a joint, you can apply like an arm board to keep them from bending it and getting it occluded. So you're going to check for infiltration. You know, look for swelling, pain, redness, phlebitis, for bleeding. And then if your infusion isn't going into the arm, you're going to want to check and make sure that the needle didn't get dislodged from the vein. And then you're going to want to teach them about some IV care kind of things. You know, make sure that they don't get it wet, tell them not to play with it. Remind them to stay by the IV pole so it doesn't tug on anything. You don't want anything tugging at it. I would ask them if they had any questions, give them their call light, make sure they're safe in their room, there's nothing on the floor, no needles hanging out. And then just come back every hour and monitor and make sure that your fluid is infusing and the IV site looks good.